Hey everybody, this is Sarah with Girl Power. I am here with our nurse practitioner, Kiarra Pearcy, and we are going to discuss women's health and ask some questions that maybe people aren't very familiar with the answers. I have a 16-year-old, and so I was kind of ask some questions based from maybe a younger point of view. Mm-hmm. Okay?
Yep.
All right. How are you?
I'm good. Thank you for having me.
Of course. Thanks for being here in the studio.
Yeah.
So, a lot of people don't love going to the doctor. That's definitely an issue that people have. Mm-hmm. So I went on to Reddit and just found some young girl questions, and we're just going to discuss them today.
Okay.
My first question is, as a minor, so like as my 16-year-old, when she goes in for her first OB-GYN visit, what can she expect with that? Because they're probably pretty nervous, anxious, and dreading it.
Yeah, for sure. So usually, obviously, age plays a factor. If we're under 21, and most patients in general, the first time I meet them, we usually just go and have like a sit-down conversation before we do any physical exam, anything like that. So try to get to know them a little bit so that they're more comfortable, because obviously it is a visit. Specifically, I would say there's a lot more anxiety around that type of visit when it's women's health.
Yes.
So usually, and parents are allowed to come too, like if they want their mom to come, support person, friend, whoever. But usually kind of just talk with them, get to know them. I would say a big factor for what we're doing at that visit depends on their personal history. So if they're sexually active, then we will always offer like STD screening if they want to do it. Like if they want STD screening. Sometimes we'll let them do like the test themselves because it's just a cotton swab. So something that they can do on their own. Usually we don't start doing pap smears, like the pelvic exams, until 21 or the sexually active component. So,
okay, that's good to know.
Yeah, it's a very new, not new, but it's newer guideline, the pap smears. So, and I'll kind of break both of those down. So pelvic exam is just us actually looking at everything physical exam wise. Pap smear is the actual test that we're doing to check for cervical cancer.
Okay.
So the guidelines for pap smears are now, we start them at 21. And then if patients are sexually active before then, we offer, like I said, STD screening, or if they're having issues with their periods, pain, anything funky's going on, we can offer, obviously, do a pelvic exam and just kind of look at everything. It's usually a like collaborative decision between us and asking them like, hey, what's going on? What symptoms are you having? And then also the patient, kind of what they're wanting to do.
Of course.
So it's definitely a collaborative decision, and they can always have a support person with them. I feel like that helps make them a little bit more comfortable.
I agree. And also there are male and female OB-GYNs. As a young girl, I always went with a female just because it was more comfortable. So that's always an option as well.
Yes, always, yeah. And we usually, if it is a male, they always have, even females will have a like MA or office, like our nurse or somebody with us during the exam, just so they feel comfortable with somebody else in the room.
That's wonderful.
Yeah.
So as a young, say 16-year-old sexually active teenager, what do you suggest for birth control for their first go round and try for that?
So that, I feel like there's a lot of negative stigma in the past about birth control. I do think it has its place in certain scenarios. So obviously, if we are trying to avoid pregnancy, or if we have heavy painful periods, we're not having regular periods, definitely that's something that we bring up and talk to them about.
Okay.
There's so many different options. I feel like a lot of, back in the day, the Depo was super popular, and now Depo is still an option, but a lot of people now are looking at, there's different types of implants. So there's Nexplanon that goes in the arm, there's IUDs, there's patches, there's rings, all sorts of different types of pills, patches. I think I said that one already.
Yeah.
But there's tons of different options now, and they all have, I always tell people everybody's different. Just because one of your friends didn't tolerate a certain one or had a certain side effect doesn't mean that you're necessarily going to have that. We're all, different. Correct. So I try to give everybody all of the options, and, if people are worried about, weight gain or, certain things, there's certain ones that I can help as a provider pick, like, okay, this one is a little bit more known for having that as a side effect versus this one is not. Okay. So I always have people just kind of keep an open mind to all the options, and then I try to go over everything with them. And then they can always research it and kind of come back and be like, hey, this is what I'm thinking. What do you think?
I love that there's options available because when I was 16, it was the pill. And I was so worried that if I did not take it at the same time every single day, I literally had an alarm at 6 o'clock. Even on the weekends, I would wake up at 6 a.m., take my pill, and go back to sleep. So as a flighty 16-year-old, the fact that you have so many options now is really beneficial.
Yeah, super helpful.
Okay. Also, speaking from a teenager, what would you say about irregular periods? I don't want to talk about my own child because of her friends, but it's not always regular. So, I mean, if it's only like once every 3 or 4 months, is that, what do they do about that? Is that okay?
So it's usually definitely patient specific. So if it's over 3 months, that's usually a guideline for us as providers. Like, hey, we should probably talk to somebody. Like as a mom, I would say, hey, I would have your kiddo talk to a doctor about that, and at least let them know, like, hey, this is what is going on with our cycles. So it is common for teens, like especially when they're starting their periods, to have irregular periods. So they might have it once a month, and then they may skip a couple months, and then they start back once a month, that type of thing. That's a very common scenario. So to break that down a little bit, usually we don't want people going more than 3 months without a period, but it's case specific. So some people with like a lower BMI, they may, for example, not start their periods until they're a little bit older. That can, a lot of things, different things can impact our periods. So caloric intake, are you super physically athletic in sports? Another thing is, are there other symptoms going on? So are we having abnormal hair growth, like chin hair or upper lip hair, and skipping periods for 3 months at a time? So it's kind of we look at like all of the picture, not just the fact that our periods are doing that. Another thing is, it's simple as we're not fully developed yet when we're 16. So there's a feedback system, we call it the HPO axis. But that feedback loop where it tells our ovaries when to cycle, it's not fully developed until our mid to late 20s.
Wow.
Yeah. So usually we work it up. A lot of the times it's nothing. It's just that development is not there yet.
Okay.
But I do think it always warrants a visit with either your primary or OB-GYN to talk about, and just kind of let them look at the full picture and make sure nothing else is going on.
Okay.
Yeah.
And usually getting on the birth control will also help regulate that, correct?
It does, yeah. Okay. And it's more of a, how that works, or how birth control in this scenario of regulating cycles is, instead of letting your body try to control your periods and your hormones, since it's not developed yet, we can just kind of control it on our own with that pill. And so the real big factor for that is, you don't want to go over 3 months without periods, just because if you think about it, that lining is just kind of sitting there for 3 months, and you don't want to chronically let that be what's going on. And so that's when we say, okay, hey, we might need to intervene with birth control. But there's lots of other options too. And like I said, kind of getting to the root cause of like, why is it just that our development's not fully there yet, or is there something else going on, like PCOS, things like that?
So this question I did not bring up beforehand, but my sister was always one of those terrible cramping periods, like a heating pad, having to miss school. Why is it so different for some people versus like me? I never was really, I'm obviously a hormonal PMS, grouchy, snacky, but I never had the cramps and headaches. So is that just a hormonal fluctuation?
It can be. So lots of different possibilities in that scenario. It depends, like if they're having really heavy periods. The pain thing, if you tell me, like classic period is someone saying, well, 1 to 2 weeks leading up to my period, I have severe pain. That's when it starts, and it lightens up within a couple days of starting my period, but I'm missing school, I'm missing events, I can't get out of bed. That should not be our norm. That is definitely worth going to your doctor and being like, hey, this is what's going on, kind of looking into things. For that scenario, I'd question for endometriosis. So normal period pain, you should have, some cramping and discomfort a day or two before first day, nothing that Tylenol, ibuprofen can't kind of manage, and then, manage and go on about your life. But if it's interfering where you're skipping school and you're laying in bed all day, that's definitely warrants going to the doctor to talk about.
Okay.
Yeah.
And then also something that's become a little bit more popular since we were younger is the HPV vaccine. So tell me about that, and who should be getting it and why?
So right now, the recommendation is ages 9, as young as 9 and up to 12 is when they say you can start doing that. It's usually like a 2 to 3 part series, depending on what age that you get the vaccine. And what it is for is it's preventing the risk for HPV virus. So there's about 100 different strains of HPV. They all can cause different things. So some strains can cause cervical cancer, some can cause genital warts, some cause nothing. The HPV vaccine has had actual great research and studies at causing a decline in cervical cancer. So it's got a good track record. It's been around for several years at this point. Okay. You can get it. Usually they want most people to get it before 26, but you can get it up until that age. So risk factors for HPV, if you have more exposure to, so like sexual partners, lifetime partners, you have higher risk for getting HPV. So they want us to try and have patients get the vaccine before they're sexually active.
Okay.
Because once you get HPV, it's not going to treat it, make it go away, anything like that. There's not a treatment for HPV. It's a virus. Our body usually does clear it on its own, which is great. But there's some scenarios where it doesn't, and that's when it can lead to the other issues. I think something also that's really interesting is HPV is one of the leading causes for like esophageal and throat cancer and rectal cancer. Oh. So it causes a lot of other cancers besides cervical cancer. I have this conversation with patients a lot because sometimes they will get that birth control that's 99.9% effective. And then they're like, oh, well, I don't need to use condoms because I've got this birth control and I'm not worried about getting pregnant. I'm like, well, condoms are still going to prevent, obviously the STDs that we can treat with antibiotics, things like that. But HPV is something that I feel like we don't educate people as much about. And we don't think about like, hey, 10 to 20 years from now, you could get cervical cancer because of this HPV virus. Yeah. So I think that's a big thing to educate people on is, yes, there's some that we can treat with antibiotics, but there's some that we don't have any treatment for and they can lead to cancer. So
you might as well try to prevent it the best you can.
Yeah. Yeah, like I said, the track record for the HPV vaccine has been great so far.
Okay.
Yeah.
Oh, yeah, that's great.
Yeah.
And then also for our youngsters, the young women, they should also be doing self-breast exams.
Yes.
So usually once a month when you're getting ready to start your cycle.
Yeah, I usually tell them you can do it on your period, or it doesn't really matter when you choose to do it throughout the month, but make sure you're consistent. So if you do it on your period, make sure you do it every month on your period because our breast can change throughout the month just based on like hormone fluctuations and things like that. So you want to just be consistent. A lot of people, when I ask them like if they do them, they are hesitant to say that they do because they're like, well, I don't really know what I'm looking for.
Exactly.
So I usually tell them the big thing for me as a provider when I'm telling people to do them is getting your baseline. So some people do have lumpier breasts than others, but you just want to know what yours feel like on a day-to-day so that you know, hey, this month or, that last month I didn't feel this and now all of a sudden I do. That's when you call your doctor and say, hey, I have a lump here. I didn't notice it last month and it's not my baseline and I'd like to get it checked out. That's kind of what I'm looking for.
That's smart. Yeah. Because I was never one to do these self-breast exams. When I started doing them, I found a weird spot. Then I had to go have my first mammogram. And I remember sitting in the parking lot in tears because I was so scared of going in. And it was just nothing.
Yeah, no. And I even sometimes when I do breast exams probably 20 times a day.
Yeah.
I'm more on the err on the side of caution. So even if I'm like, I don't really know, like it doesn't feel suspicious, but I don't know what your baseline is. Like if I've never seen them before or something like that, I'm like, let's go ahead and just peace of mind, do an ultrasound, make sure everything looks good. And then that we know in the future, okay, this is here, we know about it. And maybe it will be nothing, but I think it's peace of mind too.
Yeah, I agree. So when they come in the next year, they're already prepared for what to expect.
Yes, exactly.
And also with the OB-GYN visits, if we're starting at a young age, 16, 17, how often do our young girls need to come in for those?
So usually if it's just like a wellness exam, we're just seeing them once a year, or like if we get them on birth control, we usually will do once a year. If they're having issues, obviously they can come see us anytime between that period. But usually for most people, I recommend at least once a year.
Okay.
Yeah.
That's perfect. That concludes my questions. Did you have any other information you want to throw out there?
I would say one thing that I was thinking about when I was preparing for today was a lot of women that get hysterectomies, which I know this is like an older probably age group question or topic, but a lot of women question the guidelines, like on how many times they should see us, like after hysterectomy. So even if you don't have a cervix and uterus, I personally think that you should still come see us once a year just for a physical exam and to look at everything. Because as we age, there's lots of different skin conditions, like in sclerosis. It's kind of like I kind of compare it to like eczema, but we get itching down there. So there's skin conditions. There's other things that we can check and find that the patient may not know about because you can't see, obviously, like we can when we're down there doing the exam.
Yeah.
So I think that women that do have hysterectomy should still follow up at least once a year for breast exam and then a pelvic exam and just kind of address any other issues that they're having, perimenopausal questions, menopausal, all that type of stuff. So I think once a year, and your insurance usually covers it.
Yeah.
So to me, why not spend the time and at least kind of just get everything looked over?
Gives you a day out of school or off work. Like,
Yeah.
woohoo.
Yeah, I agree. Yeah.
And then you can treat yourself afterwards. Like, oh, I went to this appointment I really didn't want to go to, so I'm going to go and treat myself to Mexican food for lunch.
Yeah, exactly. So.
Okay. So thank you so much for coming into the studio. I'm going to see you again in a couple weeks. And I think I want to discuss something a little bit more my range, which is the perimenopause.
Yeah.
So
that's a big one.
That's fun. So to have that and a 16-year-old at home, it's joy all the time.
Yeah. Yeah, I can imagine.
All right. So thank you. And to our audience, if you have any questions that you would like us to answer, drop them in the comments below. We are going to continue this every few weeks. And we want to be able to reach our audience and help with any questions that you might have for your medical as well.
Thanks for having me.
Thank you. Girl Power is brought to you by Harry Salon, June and Beyond Women's Boutique, Shelter Insurance with Kim Breeden, Cafe Jude's, and Tees Tees. Thank you for being a proud sponsor of Girl Power.